prostate cancer is making a troubling comeback, and it's hitting harder than ever. A newly released report from the American Cancer Society, ACS, has unveiled a startling reversal in prostate cancer trends across the United States. After decades of decline, the rate of new prostate cancer diagnoses has begun climbing again by about 3% each year from 2014 to 2021. But here's the part that's truly alarming. The steepest rise is in advanced stage cases, which are increasing at an even faster pace of 4.6% to 4.8% annually. These are the most aggressive forms of the disease, and their resurgence is raising serious red flags. And this is the part most people miss. While the number of deaths from prostate cancer had been steadily dropping for years, that progress has slowed dramatically. Mortality rates now decline by only 0.6% per year, far less than the 3 to 4% annual drops seen in the late 20th century. This shift suggests we may be losing ground in the fight against one of the deadliest male cancers. The data points to a pivotal moment in prostate cancer research and care. Late-stage prostate cancer, also known as distant stage cancer, has been rising across all age groups. Men under 55 are seeing a nearly 3% annual increase, while those 55 and older face a staggering 6% yearly rise. Why does this matter? Because the 5-year survival rate for distant stage prostate cancer is just 38%. Compare that to the near-perfect survival rate for early-stage diagnoses, and the urgency becomes crystal clear. But here's where it gets controversial. Despite medical advances, racial and ethnic disparities remain deeply entrenched. Black men continue to bear the brunt of the disease, with death rates twice as high as white men. Even more perplexing, Native American men have a 12% higher mortality rate than white men, despite having 13% fewer diagnoses. American Indian and Alaska Native men also show the highest rates of late-stage diagnoses, suggesting that systemic inequities are still very much at play. Geography adds another layer to the story. States with large black populations, like Washington, D.C. and Mississippi, report the highest death rates, 27.5 and 24.8 per 100,000 men, respectively. These numbers highlight how location, race, and access to quality healthcare intersect to shape outcomes. The ACS report urges targeted, community-based strategies to improve screening and care in these high-risk areas. From a scientific standpoint, the findings raise complex questions. Why are more men being diagnosed with advanced cancer despite widespread screening? Could changes in tumor biology, delays in diagnosis, or evolving screening protocols be to blame? And what about the role of genetics, environmental exposures, or emerging biomarkers? These are the mysteries researchers must now unravel. Tyler Kratzer, MPH, the study's lead author, stresses the importance of personalized screening strategies. He recommends that all men begin discussing prostate cancer screening by age 50, but suggests starting at 45 for Black men and those with a family history of the disease. This approach aims to balance the benefits of early detection with the risks of overdiagnosis, especially when using prostate-specific antigen, PSA testing. On the policy front, the findings lend strong support to the PSA Screening for Him Act, a proposed federal law that would remove financial barriers to screening for high-risk men. By eliminating deductibles, copays, and coinsurance, the legislation could make life-saving tests more accessible, particularly for underserved communities. Rebecca Siegel, MPH, the report's senior author, emphasizes the ethical responsibility to close these gaps. She argues that equitable access to early diagnosis and treatment is not just a medical goal, it's a moral imperative. The ACS is doubling down on efforts to direct research and resources toward communities most affected by prostate cancer. prostate cancer remains the most commonly diagnosed cancer among American men, accounting for nearly 30% of all male cancer cases in 2025. It's also the second leading cause of cancer death, trailing only lung cancer. This year alone, the ACS projects 313,780 new cases and 35,770 deaths, a sobering reminder of the disease's enduring impact. The report draws on robust data from national cancer registries managed by the National Cancer Institute and mortality statistics compiled by the Centers for Disease Control and Prevention, covering incidence through 2021 and deaths through 2023. The dataset offers a comprehensive view of trends and disparities. The research team behind the report includes experts in epidemiology, oncology, and public health. Among them, Kratzer, Siegel, Natalia Mazzatelli, MPH, Jessica Starr, NPH, Dr. William DeHoot, and Dr. Ahmadine Jamal. Their collective insights provide a nuanced understanding of the shifting prostate cancer landscape. So what does this all mean? The ACS report is more than a collection of statistics. It's a wake-up call. It urges the medical community, policymakers, and the public to confront the rising tide of late-stage prostate cancer, rethink screening strategies, and tackle the deep-rooted inequities that continue to shape outcomes. Do you believe enough is being done to address these disparities? Should screening guidelines be more aggressive for high-risk groups? Or is there a danger of overdiagnosis? Share your thoughts in the comments. This is a conversation we all need to be part of.